Well, thank you for joining us again. I'm Dr. Richard Hurley. I have a special guest today, Dr. Ryan Hsu.
Yes, thank you for having me. Excited to be here.
And so we are actually going to talk about something completely unrelated to spine today. We're going to talk about our experience in the military. So I'm in the Army.
And I'm in the Air Force.
Yeah, awesome. So let's see. I joined the Army after I got an acceptance letter to medical school. I'm assuming you probably did something. Actually, you didn't. You did something different, right?
Mine was a little different. I did get an acceptance to medical school, yes, but I joined the Air Force secondary to that.
Yep. So I had no idea that there was this program called the Health Professional Scholarship Program when I was applying for medical school. I kind of found out about it, honestly, by accident through like a Google search, I think. Keep in mind, this was like in 2007, so it was a little bit before you. But I did know that I had already gone to college. Well, so did you know that I was like a non-traditional student?
I had an idea, but I don't think you ever told me this whole story.
Yeah. So, I'll give you my background first. So I was, in college from 1997 till 2001. I have a business degree, so I didn't major in biology or chemistry or any of the kind of the standard, things. I had a business degree and I had a job, in fact, right out of college in business. So, but I figured out very quickly that that was just not the path that I needed to be on. And ultimately made the decision to go back to school actually at night and take a bunch of classes so that I could apply for medical school. So it took me a little while to do all that. I had to take something like 36 credit hours at night while I worked, which was hard. But I figured out, obviously I wanted to do medicine, and then in the process, while I'm working, while I'm going back to school, I'm paying off all my student loans from college, right? I mean, my father had actually done so much to help me in college. So I wasn't like I was riddled with debt or anything like that when I got out. I was very fortunate, honestly. But I did have some debt. I paid it off. And what I realized was that I did not want to go back into debt again when I went to medical school. And medical school is not cheap. So something else happened in 2001 when I graduated. We got attacked at 9/11. And I knew on that day I was going to join the military at some point. I just didn't know how or why, or, I didn't know what I was going to do yet. So when I heard about the Health Professional Scholarship Program, I was like, well, that's perfect. That's right in line with what I want to do. And it allows me to fulfill this dream of also being in the military. So that's kind of how I stumbled into the HPSP program. But how did you get in it?
Mine was a little bit more by like happenstance. I didn't know about it at all. I graduated college and I knew I wanted to do medical school, but I was worried about like the financial burden.
Where'd you go to college?
I went to UCLA. And I was there 2012 to 2016.
Okay.
Then I took a gap year where I didn't really do too much medicine related. I was just preparing my application, teaching some math. I got a tutoring center.
Oh, cool.
And then I just knew I needed...
So you're a nerd.
A little bit, yes. A little bit of a nerd. But my parents also helped me through college, which was nice. So I didn't have any debt coming out of undergrad.
That's awesome.
But I knew that medical school would incur a lot of financial burden on myself. And I was just trying to find a way to, separate myself from my parents and kind of do things on my own.
Yeah.
And then I got like a random email from a recruiter.
Okay.
And that's how I found out about the program. And that's how I ended up in the Air Force as well.
Okay. And so where did you go to medical school?
I went to medical school at California North State University, which was 3 years old at the time when I started.
So it's a fairly new program.
Brand new.
Private, so probably also
private for-profit medical
very
school.
Expensive.
Extremely. I think the tuition at that time was $60,000 a year.
60. Just
to attend, correct.
So that's just covering your tuition.
Just to be there.
Just it didn't cover any of your living expenses in Northern California.
Correct.
Okay, so it's going to be a very expensive endeavor for you.
I think
at a minimum, $250,000.
Correct. Most of my classmates that didn't have scholarship or financial aid or whatever, they took out $300,000 or $400,000 in loans.
Oh my. Okay. Yeah. My medical school was a little bit cheaper. So I think the Army actually got a pretty good deal. So I went to UT Health Science Center in San Antonio, and I think at the time it was $15,000 a year.
That's a steal.
Tuition. So maybe we can talk about the differences between Texas and California on a different episode.
Yes, sir.
But I think they got a pretty good deal because it was a little bit cheaper for them. than it was for you, but that's all right. So I followed this gentleman. I kind of Googled, health professional scholarship program, and I discovered this guy named Luke Ballard. So Luke was I think he was in the Air Force, if I remember correctly. Anyway, he joined the HPSP program, and he chronicled his path on a blog. So that's what I read at the time to try and, wrap my mind around this whole process and try and understand it. Because, I mean, there's resources obviously on the Army website, but then you also kind of want to hear somebody else's perspective, right? That's kind of what we're doing today, is giving our perspective of the Health Professional Scholarship Program. So I had followed Luke Ballard, and I think he wound up being a radiologist in the Air Force for a long time. I think he may have even retired, because I tried to look him up again, and his blog is still out there. It hasn't been updated in quite a while, but I found it again and looked at it. But that was kind of what I used. Did you have anything like a resource that you used?
Once I found out about it from the recruiter, I realized there were some people that were in the same medical school that had gone through the program or were in the process of going through. So I kind of reached out to them, and they gave me some insight, but they were still really early in the process too. So I didn't have anyone to that had gone through the whole, back through residency or anything beyond.
Yeah, I did the same thing. So there was actually a guy named Joe Dannenbaum. So he was he was a Texas Aggie. So he had graduated from Texas A&M. He's actually an orthopedic surgeon now. I think he's out of the Army. But Joe was my resource. He was a medical student who was 1 year ahead of me, also interested in ortho, also HPSP scholar. So I kind of, once I figured out, he was actually the one that kind of said, okay, Rich, here's the next steps. This is what you need to do next.
Right.
So Joe really kind of helped guide me. So that was really, and he's a super nice guy. So hopefully, shout out to Joe. Hope your practice is going really well. So when I decided that this is what I wanted to do, I don't know if I told you this, but I actually signed up to be in the Air Force. So
I did not know that.
Yeah. So I talked to the Air Force recruiter first. Did they send you to MEPS?
They did send me to MEPS.
Yeah. So, I fill out my application, and I think their first step was to send me to MEPS. So MEPS is like where they go and they evaluate you to make sure that you're physically fit for the military. So I went to MEPS in Dallas. Where'd you go to MEPS?
I went to MEPS. They sent me to San Jose.
Oh, okay.
In California.
Somewhere in California. Got it. Well, while I was at MEPS, I ran into an Army surgeon. And that Army surgeon said, "Hey, Rich, why are you joining the Air Force?" And I said, "Well, my grandfather was in the Air Force. He was a pilot. I just figured, Air Force is the way to go." And he said, "Well, there's 4 times as many surgeons in the Army as there are in the Air Force, don't you?" And I said, "Oh, I had no idea." And he said, "Yeah, and your likelihood of promotion is actually better." And I said, "Really?" And I don't know if any of that is true, but I left MEPS and I called my Air Force recruiter. And I was like, "Hey, can you drop my packet off with the Army guy that's sitting across the hall from you? Because I want to switch branches." And he was mad. He was so upset with me, but he did it. And ultimately I wound up joining the Army instead of the Air Force. And my grandfather actually was not happy with me either.
Yeah, I believe that.
Yeah. He was like, "You're making a mistake." And I was like, "No, I'm not." So, but then there's also the background check, right? So did you have to fill out paperwork for that?
Yes, there's a background check. After you do the MEPS, they make sure you're medically fit to do all the things that the Air Force or Army or Navy needs to do. Yeah. And then there's a background check where you provide some contact information,
right?
Personal contacts, and they kind of call them, I think, or just interview them to make sure that you're a normal, law-abiding citizen. I think is the most important thing. Yeah.
And then once they, approve those 2 things, then it's really just a matter of need and want. Now, the one thing I would say is, above all else, and I don't know if you agree with me or not on this, and you don't have to, by the way, but for me personally, I knew that I wanted to be in the military. So I wasn't just doing this strictly for financial reasons, although it was a very, it was a driving force in that decision-making process. It was not my sole objective, right? Mm-hmm. I mean, there are other ways to get medical school paid for. You don't necessarily have to join the HPSP program. But for me, I knew that I wanted to be in the military. I don't know, did that play a factor in your decision-making process?
I would actually say I didn't have an inclination to join the military, but I knew that this was a a for sure way that I was going to be able to attend medical school and get it paid for and like, you know, get my finances in order and everything. Yeah. So I don't think initially I did, but you know, after being in residency for 4 years now, I think that my kind of outlook has slightly shifted in that regard.
Yeah. So then after, you know, after I had my acceptance letter, you know, after I, you know, started school, then, you know, I started learning more about actually what the HPSP program actually means, right? So, you know, they give you a sign-on bonus, which is actually really nice. It's a $20,000 sign-on bonus.
Correct.
But they do take taxes out of that.
They do tax it.
That's true. Yeah. And then they give you a stipend every month. Now, when I got my stipend, I think it was $1,700 a month. Now it's more than that now. I think it's $2,700.
Yeah, $2,700 now. I think it was like $25 when I was going through medical school.
Yeah, so they do make some adjustments, and that money is designed to help you, you know, pay for your apartment or pay for your food or whatever the case may be.
Correct.
Yeah.
I think they also do something with textbooks. You can submit receipts if you buy a laptop or buy textbooks and stuff, but just separate from the stipend.
Yeah, I got to do that too, and then. They do pay you differently each year, which I didn't realize. So you go on active duty orders 45 days out of the year, right?
Every year that you're on scholarship, that's correct.
Yeah. So your first, did you go to? So you're in the Air Force. So in the Army, we go to something called Basic Officer Leadership Course. Did you have something similar?
We had commissioned officer training where they sent you to. For the Air Force, it's Maxwell Air Force Base in Montgomery, Alabama for 5 weeks.
Okay. So you did that when?
I did that right before medical school. I went in like April and then I started in August. So.
Gotcha. So they send us between first and second year.
I don't know if it's a mandatory, because I know some people that do it like after they graduate, but I think you do it before you start residency.
Yeah, there's definitely a hard cutoff now. So my story is actually very interesting. So I didn't know anything about this basic officer leadership course, believe it or not. I mean, I kind of had an idea about it, but I didn't know that you were supposed to do it between your first and second year. And I had already signed up to do research. So I actually didn't do basic officer leadership course until much later, which you can't do that now. Like they want you to have that done before you start your residency program in the military, which we should probably talk about that too, because you don't necessarily have to do a military residency now. I don't think. I think there are some civilian deferment slots available, especially for orthopedics. It's going to be hard for me to kind of talk about anything outside of orthopedics.
Same.
That's what I know. Yeah, exactly. You too. But basic officer leadership course has to be completed now before you can start residency. So that is a definite change. And then, so yours was in, where was it again?
Mine was in Montgomery, Alabama.
And you said it was for 5 weeks?
5 weeks. Yep. They kind of.
What'd you do there?
Yes, they teach you like a lot of PowerPoints about military history and the Air Force thing, and you get to march around and there's some drill instructors that yell at you. They kind of make it sort of like what basic training would be, except everyone is a professional. Everyone's either an attorney, a chaplain, or in the medical field.
Oh, okay. Yeah, so when I went to basic officer leadership course for the Army, it was actually here in San Antonio. Oh. Yeah, so we went to Fort Sam Houston for the didactic portion, and then we were at Camp Bullis, which is also just north of San Antonio, for the field training exercises and stuff. So that was pretty neat. But yeah, it was kind of like, okay, now you get a taste of what it's like to be in the military. You get to do ruck marches, you get to do night nav, you get to do all that, fun stuff. And I think that course is somewhere around that 6 week length for the Army. For me, it was a little bit longer. Mine was 12 weeks. Oh, yeah. Well, that again, it's because I went off cycle. Got it. Yeah. So I didn't do it the normal traditional way. And then we should probably also talk about how you transition from medical school to fulfilling your commitment. So you're in the middle of fulfilling your commitment. Of course, I'm a little bit further along. Correct. I'm still fulfilling mine.
Yes.
So let's talk about your commitment and how you got into orthopedic surgery and maybe how you decided that.
Sure. The HPSP scholarship is offered for either a 4-year scholarship for every year in medical school or 3 years.
Right.
I did 4 years because I started before.
Right.
So you incur 1 year of active duty service commitment for every year that you're on a scholarship. So when I finished residency, I will owe 4 years of active duty service commitment to the Air Force, just baseline, unless I extend for some reason or go to fellowship or something like that.
And how did you get into the orthopedic surgery residency program? I mean, I know how you got in, but why don't you tell us about that?
Yeah, I mean, the normal pathways in medical school, you do a bunch of rotations in every specialty.
Right.
You have a big kind of fork in the road in third year. You either like the OR or you dislike the OR. If you like the OR, you kind of filter out, do I like general surgery? Do I like doing bowel and, GI stuff? Or do you like other surgical specialties? And for me, I particularly was interested in like the musculoskeletal system. I thought the surgery was more fun. You have a tangible result that you can like improve patients' outcome, improve their function, and they're generally happy, at least from what I saw. And then that's kind of what made me go towards orthopedic surgery in general. And then fourth year, you apply. When you're HPSP, at least in the Air Force, you can apply civilian and to the military match because every year there's a little list that comes out. They tell you how many slots are available for civilian deferment, which is you are not on active duty orders. You are basically a civilian resident until you finish your residency, and then you come back on active duty orders, versus a military residency, which is you're active duty the whole time, which is what I currently am doing here in San Antonio.
And I think there's still more, I mean, correct me if I'm wrong here, for the Air Force, there's still more civilian deferment slots.
That's correct.
Than there are active duty slots, correct?
There is one active duty orthopedic surgery residency spot in UC Davis, which is a civilian program, although you're an active duty resident. There's 3 here at Brooke Army Medical Center in San Antonio, and they opened one at Wright-Patterson.
Oh, that's right. That's a brand new one, right?
It's brand new. First year was last year.
Okay.
But aside from that, there's usually like 10 to 14 slots in civilian deferment, which is you just are a civilian applicant. Right. You just apply in the normal match.
Yeah. And I think there's actually I know that there has been one here in San Antonio at UT. So I think it doesn't really matter where you go as long as you get an acceptance letter, right?
Correct. The Air Force has to say that you are suitable to go into the civilian match. You get the deferment, and then you apply the civilian match, and you match like all other civilian residents. March is when the match comes out, so that's usually when they find out.
Yeah. And then for the Army side, I remember when I was going through it, there was Brooke Army Medical Center, there was Walter Reed, there was Eisenhower, which is in Georgia. There was El Paso. There was Madigan, which is in Tacoma, Washington. And then there was Hawaii, Tripler.
Hawaii,
yeah. So when I was doing my audition rotations, and we should talk about yours too, I went to Tripler in Hawaii, and I went to Brooke Army Medical Center, and I went to El Paso to basically do my audition rotations. And then ultimately I matched at Brooke Army Medical Center. Now you match a little bit earlier than the rest of the match too, which is kind of nice.
Yes.
I don't remember, was it in December that we matched?
For December is usual for the military. Yeah. My year was a little different because I had the COVID year cycle.
Oh, okay.
So that kind of messed the timeline up, but yes.
Yeah, so you actually kind of find out where you're going before all of your classmates, which is cool.
3 or 4 months before, and you're kind of cruising.
And where did you do your audition rotations?
So since I was auditioning in 2020, there was like a ton of restrictions. The military actually only allowed us to start rotating at our auditions in August. So I went to UC Davis in like the end of July, and I came here in like mid-August or end of August. And they only allowed 2. And even in the civilian side, you could only do like 1 or 2 away rotations, and everything else was virtual.
Got it.
Or like just an interview.
Do you have any idea how it is now?
Now I think, the HPSP program will pay for 2 active duty audition rotations, at least for the Air Force.
Yeah.
And then you can fund yourself other away rotations if you want.
Now, for the Army, I remember the year I matched, there were no civilian deferment slots. So you were either going to do an active duty orthopedic surgery residency or you weren't. You had to.
Do they have civilian sponsored in the Army? Or?
I don't think they do. Now, I could be wrong about that, but I don't think much has changed. I still think that you have to do it, in the Army, which I think honestly is a good thing. Because the training is so good. Right. But I don't know, I'm sure people have different perspectives on that. So, and then I guess, the only other thing that I would touch on is that you have a resource available to you when you're an HPSP scholar. It's the GME office. So did you interact with the GME office very much?
I only interacted when they like sort of have a tasking for you. Right. Like when it gets closer to your active duty service, like come in each year, they kind of send you a bunch of emails and say, hey, I need you to do either officer training. They sent me to Ohio for 2 weeks after second year to do like at the time it was called aerospace medicine something, but now it's something else. Air Force operational medicine, I think, is what it's called now.
So you did have to do that.
I did have to do that.
So that's something in addition to your...
In addition to my officer training, they sent me to Ohio for another 2-week course for...
Is that pretty standard for the Air Force?
I think it was at the time. I don't think it's mandatory now.
Okay. Did they want you to do any research or anything when you were going through the HPSP program?
I think their only requirements are you have to remain in good academic standing, and you can't like repeat a year or get held back a year or like recycle for a year or something.
Got it. So one thing we didn't touch on is like the competitive, nature, right? So civilian and military programs are pretty competitive. I mean, we know that kind of firsthand because orthopedics is one of those competitive, surgery programs. I would say that you still need to be competitive if you're planning on doing, the military match. I don't know how you feel about that, but I felt like it was pretty competitive when I went through it.
Yeah, I think that the numbers are smaller, like the pool of applicants are smaller because there's not as many HPSP people per specialty, but it is still competitive. So like my year, when I rotated here, there was like 28 of us at the same time. And you're looking for 4 spots for the military residency. So like the percentage wise, I think is the same as a civilian match probably, but it's just a smaller pool, but I would say it's still competitive.
What did you do to try and make yourself like really competitive?
I think that as much as I hate to say, but I think the medical school you come from has a role in the civilian match.
Sure.
They have a reputation. My school had none. So I had to basically focus on like my board scores and try to get research in. I didn't have any orthopedic faculty at my medical school, which made it a little more challenging. I had to really branch out in my rotations to kind of latch on to other orthopedic surgeons that are in the community. But I just tried to get my board scores like in a competitive range and try to do as much research as I possibly could and kind of get good letters from people that I worked well with, which I think would help me. Things
are a little different in terms of step 1 scores. Right now it's pass fail. Correct. So when we applied, things are a little bit different now. But our step 1 scores were super important in terms of being able to get in. Step 2 is still scored at this point.
Correct.
So I do think, some good advice might be to have a really good step 2 score to go along with your application. I don't know how you feel.
I agree. Well, I'm in charge of like the medical student recruitment this year for our program. So it is one of the few objective metrics we have, right? Everyone has a step 1 or a COMLEX, which is a pass fail, or COMLEX I think is scored, but step 1 is pass fail.
Right.
So the only objective test score we have for an MD applicant is their step 2. So I think it behooves them to do as well as they can on step 2.
Yeah.
The benefit for the military residents or the military applicants is they come here for 4 weeks and we get to know them. So kind of the step score is important, but we also get to know them like personally, which is arguably more important.
And then do you think that it's important to, if you are a DO candidate, do you think it's important to do COMLEX and STEP, or do you think it's okay just to do COMLEX?
I think that, I don't think it hurts them to do step 2, because I don't know anything about the COMLEX.
Right.
And if you're an MD, you don't really know what the score means or how it translates. And I don't know. I think that most of the DO students that applied and matched here tend to have a step score in addition.
Right.
Everyone in my class that's DO had a step score. And when I asked them, they thought that it made them more competitive to have at least a score that's, can be compared to other applicants, generally without converting it in any way.
Right. Yeah. So I think that, it could hurt you if you didn't score well.
Right.
But if you do score well, it's definitely going to help. And then, so, I mean, I think we've covered a lot of things about the HPSP program. We haven't really touched much on, what happens after you serve. So you're not doing a fellowship yet.
Correct. If I was going to, I would have applied, earlier this year, but I am going to do a generalist time.
Right.
Probably for the entirety of my commitment, unless something changes while I'm out in practice doing my own thing.
Right. And then we haven't really touched much on how long your commitment is, but it's still just 4 years, correct?
It's 4 years. I think the intern year is, for some reason, doesn't count for or against you.
Yeah.
It's just like a wash for some reason. So I only have 4 after I graduate, correct?
Right. Yeah. So I think that for me was really confusing when I was, thinking about applying and trying to figure this out. So it is a 4-year commitment. And I never knew, I guess there was like this ambiguity that I could never figure out, but yeah, it's a 4-year commitment. Now I'm a little different, right? So I only owed 4 years, but then I did a research year while I was a resident. So they actually tack on an additional year for that. So my ultimate commitment after doing that research year brought me up to 5 years. And then I decided to do a fellowship. And so that 1 year of fellowship training added 2 years of active duty service. So my total commitment after I finished all of my training went from 4 to 7 years. So now when I'm eligible to get out, it'll be after 14 years of active duty service. Right. And then the other thing that I was just going to touch on, I don't know, it doesn't really relate to the HPSP program in a sense, but it does relate to military service. I mean, I've deployed twice, right? So my first deployment was to Afghanistan. My second deployment was to Iraq. And I'm sure at some point you will also.
I'll end up somewhere overseas. Yeah. It's in our future.
It is. Yeah, it is. It's good. It's a good experience. Were you at the lectures this morning?
I was.
Yeah. So we got a little lecture about, what to expect on deployment. So that was really good. So, well, Ryan, thank you so much for coming today and talking about the Health Professional Scholarship Program with me.
Thank you for having me.
Yeah, it's a lot of fun.
Yes.
All right. Thanks. Appreciate it.
Thank you.